blazing R&B.
You a bad girl and your friends bad too.
Good evening and welcome to SA News, Substance Abuse. Today on our show, we will have Andrea covering our stimulants, Peaches giving us the scoop on depressants. I will be covering For Now with your narcotic news. There will also be a special treat involving hallucinogens. All right, Andrea, tell us what's up.
Hi, my name is Andrea Porter, giving you the update on stimulants. Stimulants are a class of drugs that cause the central nervous system to increase, causing the heart to beat faster and the brain to work faster. There are many different types of stimulants such as amphetamines, cocaine, nicotine, and caffeine. Do you know how these stimulants affect the body? Well, I'll tell you. Amphetamines help burn up energy that you already have and causes the nervous system to go into overdrive. Cocaine causes you to feel happiness and have a feeling of energy, power, and pleasure. It takes away pain and suppresses appetite. Nicotine produces a slight rush feeling and raises blood pressure as well as accelerates the heart. Caffeine helps maintain alertness and increase effectiveness of pain relievers. Although these stimulants can seem good, they are very dangerous. Some people become dependent on them, causing addiction. Nausea, vomiting, high blood pressure, and strokes are possible. If you choose to use stimulants, please use with caution. This has been your update of stimulants. Back to you, Whitney.
Thanks, Andrea. Now I'll give you the scoop on hallucinogens. Hi again, this is Whitney here reporting live with the info you need on hallucinogens. These drugs cause the brain to alter its interpretation of sensations and even produce sensory distortions. There are two types of drugs, lab drugs and natural drugs. Manufactured highs are produced from lab drugs, which are far more potent and very unnatural. The most powerful synthetic drug is LSD, lysergic acid diethylamide, and it comes from a fungus. Many people believe LSD is helpful in allowing senses to be enhanced. However, this is true, but their dreams cannot be controlled and reality becomes unreal. Perception becomes a problem. To them, life becomes a joke. PCP falls under all of the drug categories. This drug often leads to suicide. Ecstasy, or X, formerly known as MDM, is a stimulatory hallucinogen. It first dehydrates, then raises the body's temperature, creating a sexual sensation. Our natural drugs include mescaline, mushrooms, and marijuana. The high from mescaline lasts much longer. It is derived from Native American rituals because they wanted to become closer with the spirits. Mushrooms are formerly known as psilocybin. It is not commonly addictive, but is associated with the disorder, hallucinogen persisting perception disorder, called HPPD. Marijuana is another drug associated with HPPD, and it comes from the leaves of Cannabis sativus. The most active ingredient in weed or marijuana in the leaves is called THC. This high produces a feeling of almost being drunk, as well as sensory distortions or hallucinations. The effects of Mary Jane are mild sensory are mild compared to other drugs. However, after alcohol and cigarettes, marijuana is the most common. Also, baking weed in food cures the longing to be high and the munchies that come soon after. Well, your hallucinogen report. Bye.
Thank you, Whitney, for your
hallucinogen report.
Another class of psychoactive drugs is depressants, drugs that slow down the central nervous system. Barbiturates or sleeping pills are major tranquilizers. The effects, depending on dosage levels, range from mild sedation or sleeplessness to unconsciousness or even a coma. Overdoses can lead to death, such as breathing and heart action to stop. Other danger of barbiturate use is the combination of these with alcohol. Alcohol is another depressant. A common minor tranquilizer is benzodiazepines, used to lower anxiety and reduce stress. These are considered safer than barbiturates. Rohypnol is a benzodiazepine tranquilizer that has become famous as a date rape drug. Alcohol is most commonly used and abused depressant. 10 to 20 million people in the United States suffer from alcoholism. The dangers of abusing alcohol cannot be stressed enough. The number of alcohol-induced deaths increase. Today we've interviewed a couple of young kids on alcohol.
I have friends who insist that alcohol is a stimulant because they feel more uninhibited when they drink. So why is it considered
Alcohol is
depressant?
also confused with stimulants because most people think when they drink it makes them feel up or happy. Or actually, alcohol gives the illusion of stimulation because it depresses a person's natural inhibitions of behavior.
Hi, this is Whitney. I'll be filling in for Now today, narcotics. Narcotics refer to drugs that are derived from opium, which originates from the opium poppy plant and is related to heroin, morphine, and other drugs common to opiate addiction. There are 4 different types: barbiturates, benzodiazepines, which are tranquilizers, heroin, and opium, which include morphine, codeine, oxycodone, and Vicodin. How do narcotics affect the body? Narcotics can affect the body in many ways. They are used for treating pain, anxiety, aggression, and even diarrhea. Narcotics start out as prescribed medicine but are very addictive, which can make them turn into prescription pill abuse. Side effects include drowsiness, flushing, upset stomach, urinary retention, and respiratory depression. Due to your body's building up of a tolerance to the drugs, it is very easy to become dependent on narcotics. There are many dangers. The dangers include these: slow down your respiration, respiratory arrest. This includes heroin and barbiturates. The risk of contracting HIV and AIDS or hepatitis from the needle sharing is very high, which is from heroin. Also, heroin can create a risk of miscarriage, pneumonia, liver, and kidney disease. Also, from heroin, you can get scarred and or collapsed veins. Also, from heroin, you can get bacterial infections of the blood vessels and your heart valves. Also, from heroin, malnutrition because they're never ever hungry. Confusion, drowsiness, and slurred speech are a result of barbiturates and benzodiazepines, and you can overdose on all of them. Headaches, amnesia, hyperactivity, muscle weakness, and gastrointestinal problems are a result of benzodiazepines. There is narcotic abuse treatment. One thing that is important to remember is that it's not a wise idea to try to go at it alone. With the high number and severity of withdrawal symptoms associated with these drugs, it is best you detox and recover in a drug treatment program. Once you get sober, you can participate in a sober living program to help keep you off the drugs. Programs such as Narcotics Anonymous and other detoxification programs emphasize abstaining from all narcotic drugs and other abuse drugs by using a system of support, social support. Thank you. That's the update on narcotics. Have a good one.